the Canadian, for example, healthcare system?
Thank you. A few weeks ago, I was in Quebec, and Quebec are very critical folks. But they have a fiery sense of self and self-determination. And the first thing that came out of their mouths, and these were parliamentarians and community organizers and community leaders, and they said, Mike, get a universal health care going in your country. And the system that we're going to come up with will have a portion of it. Having said that, I think that the president also wanted to emphasize, because so much attention was paid to public option, that the other issues in that bill was sort of set aside or not paid attention to. If you remember, he started out talking about those who have insurance, you're not going to be forced out, you're not going to be changing it, but when that bill is signed, there will be something else that will be added to that which you have. Stability and security, meaning that it will be against the law for any plan to eliminate you from a plan because of changing your health, and you cannot be denied because of pre-existing conditions. Now, I thought about the comment about the Canadian system and the British system. They've started their path many years ago. And so, like anything, they're probably looking at themselves again and saying, there's room for improvements. And they're going to move on their improvements, and they're going to debate their own issues there. If they come here for some help, I'd like to know what it is that they seek, who they get it from, and does their insurance company or their insurance plan cover their costs for coming here? Those would be interesting answers to get. I do know that when we passed the prescription drug plan, we had a lot of folk going over there.
Okay, time is short. Earl Hopkins, please. I'm sorry. Well, there you are. That's what counts.
I have a question about the healthcare option to the government. I understand that only pertains to 5% of the people, and they are pertain to people who can't get insurance or small businessmen. For instance, we hear all over the television about small business people, maybe a family of 4, have to spend $24,000 a year for health insurance, and a small business can't afford this. They're already working on a shoestring. The other example I have, the need for the public option, is that a young emergency nurse got stuck with the needle and got AIDS. He was excluded from health insurance. The only insurance he could get was the $24,000 policy, which he couldn't pay because if he chose to pay that, he couldn't pay his mortgage. My question is, do you feel that President Obama's health care reform with the public option will be passed?
I think President Obama was pretty clear on describing what it is that he wants to see in terms of providing competition, lowering costs, and addressing the issues of those who are not insured. As well as he said that, yeah, it's about a small population in terms of the total population, but 5 million people is still 5 million people. And we cannot turn our backs to that. And you wanted to balance that by saying the other folks will also benefit from this. And so I think that it's going to be a test and a testament of what kind of country we are, what kind of citizens we are, when we look to the least of us to find ways to help them. And he also said everybody's got to have a skin in the game, meaning that everybody's going to put something into the pot. And if you are the poorest of the poor, you will get some help, but you still do something into that, put something into that pot.
Why does Congress?
Okay. We want to thank all of you for coming out this afternoon. want to thank Congressman Condon for coming here today as well. Now, as a little favor, it's absolutely wonderful. If you would please exit through this door, right on my right and on your left, we thank you very much.
I'm saying yes to reforms within the system. We need to have a church process. Church companies are
Oh, we got